Cancer of the cervix is the most common cancer in Zimbabwean women. It is responsible for up to 15% of cancer-related deaths. The Cancer Association of Zimbabwe has not taken this lightly. They see the suffering of women affected with cervical cancer, and today they share with us their plans on how to help these women.
Welcome to the Cancer Association of Zimbabwe. We are talking about cervical cancer. Cervical cancer is the leading cancer in Zimbabwe. It is the commonest amongst women and the leading overall. Going by the 2010 statistics, you would find that about 32% of the cancer cases amongst women were cervical cancer, and you would find that it contributed 18% to the overall number of new cancer cases that were seen in the year, and about 15% of cancer deaths in Zimbabwe in that year. So cervical cancer is a very serious disease in Zimbabwe.
But also in particular for our Ministry of Health and Child Welfare, because we've been losing a lot of lives, including some very prominent people in our society. According to the 2010 National Cancer Registry report, there were 4,520 new cases, comprising 1,837 males and 2,683 females.
The main risk factor, or the main factor behind cervical cancer, is an infection known as the human papilloma virus, HPV. This is a virus which is sexually transmissible, and women usually contract the virus from their sexual partners, and women who practice high-risk sexual behaviors are at a higher risk of contracting this infection, which will ultimately lead to cervical cancer. So this May, as the Cancer Association of Zimbabwe, we have dedicated the month to raising awareness on cervical cancer.
All our provincial hospitals currently and the central hospitals are doing screening. So we hope that that rollover will also take place so that all women can be screened, starting from the district level, going upwards.
VIAC means visual inspection with acetic acid and cervicography. This is a new method of screening for cervical cancer. When we are talking of screening, these are tests which are done to pick diseases before they start showing their signs and symptoms. So before you see anything wrong with you, you can undergo screening so that diseases such as cervical cancer can be diagnosed on time. And the VIAC way of screening is now the commonly preferred method of screening for cervical cancer, especially in setups like Zimbabwe. It has an advantage in that it is quicker and people get their results there and then, when you compare with other screening ways such as pap smear, where people have to come back later for their results after they have been screened.
This is where the cervical screening is done. The procedure lasts 5 to 10 minutes, but you find the whole procedure when we are with you will take about 20 minutes. The reason being, when you leave the screening room, you should have enough information about cervical cancer and about self-breast examinations.
Our approval for the human papilloma virus vaccine went through quite successfully. So in this country, starting in 2014, we will be doing a demonstration program in 2 of our districts, where we are actually going out to give young girls aged between 9 and 13 years old the human papilloma virus vaccination. And why are we starting with 2 districts when the country has 62? The reason is that it is a new vaccine. It is being given well outside our usual comfort zone of children under the age of 5, and it's only looking at girls. So in terms of our socio-cultural and behavioral practices, there are some questions that we need already to be answered in that small pilot before we roll out the program nationally. Most of our patients hardly make it to the level where the cancer diagnosis is actually made, and those who do only do it when it's already too late.
Women are encouraged to undergo regular screening with cervical cancer to help pick up any cancer cases early when treatment can still be effective?
A proportion of it depends on our behavior and sociocultural practices. We need already to start spreading the word in terms of informing others that these cancers do exist, trying to demystify some of the myths and misconceptions that then sort of impede people accessing services by giving the correct information. And I'm happy about the work that the Cancer Association of Zimbabwe is doing in that respect.